arterial blood gases, take sample from arterial line. And now collection of ABG specimen. How to collect the ABG specimen? So first obtain vital sign. There are 4 vital signs: temperature, pulse, respiration and BP. 4 vital sign plus pain assessment, that is 5. Fifth vital sign is pain and sixth one is O2. Then determine whether the client has an arterial line in place. Determine that arterial line is in place. Then allow for arterial blood sampling without further puncture to the client. If there are one arterial line is present and it is patent also, then do not have to puncture the another one for taking arterial line. So determine whether the client has an arterial line in place. First vital sign, then determine arterial line, then third one Allen test. Allen test is performed to determine the presence of collateral circulation. Collateral circulation. And now what is collateral circulation? So provide alternative route for blood flow when another artery or vein becomes damaged. Provide alternative route for blood flow when another artery or vein becomes damaged. That means if this is your collateral artery, so if this artery is damaged, then the blood flow is running from this new artery. So that means that it is the collateral circulation. Provide alternative route for blood flow when another artery or vein becomes damaged. Assess factor that may affect the accuracy of the result. Changes in O2 setting, suctioning within the past 20 minutes or client activities. Yes, I already told you that sixth vital sign is O2. So assess factor that may affect the accuracy of result. Changes in O2 setting. If we conduct a suctioning before the ABG, so that may have a chance of altered oxygen saturation in the body. If the client is uh, doing some activity and at that time the client has lack of O2, so if any activity is done by client or any activity is done by us like suctioning, please hold for 20 minutes before taking ABG. Then next, that is provide emotional support. Then assist with the specimen draw. Prepare a heparinized syringe. Prepare a heparinized syringe. Then after obtaining a specimen, prevent any air from entering the syringe because air can cause a blood gas analysis alteration. That means if after obtaining a specimen, prevent any air from entering the syringe because air can cause blood gas analysis alteration. Because if the syringe have some air, so it may chance that blood gas analysis is altered. Apply pressure immediately to puncture site following the blood draw. Apply pressure. Okay, if we take the arterial blood from this from this side, so apply pressure for apply pressure immediately to puncture site following the blood draw to maintain pressure for 5 minutes or 10 minutes if the client is taking anticoagulant. In general, we have to maintain the pressure for 5 minutes, but if client is taking anticoagulant, then we have to apply the pressure for 10 or more minutes approximately. Label the specimen and transport it on ice cube to the laboratory. Appropriately label the specimen and transport it on ice to laboratory. On the lab form, record the client's temperature and the type of supplemental O2 that the client is receiving. So lastly, we have to record the client's temperature and supplemental O2 type on the laboratory form. So in shortly, first step is to obtain vital, then determine arterial line is in place, then LN test, then assess factor that may affect the O2 saturation, then emotional support, then prepare heparinized syringe, then apply pressure, then if the patient is normal, then not taking any anticoagulant, then apply pressure for 5 minutes, and if patient is taking anticoagulant, then apply the pressure for 10 or more minutes, then appropriately label the specimen and transport it on ice. Then on the laboratory form we have to record the client temperature and supplemental O2 type. So that's all for arterial blood gas, and remember that take the sample from arterial line, not the vein. So that's all. Thank you.